Healthcare organizations are asking hard questions and taking a closer look at their efforts to serve diverse populations. PrairieCare has recently appointed a psychiatrist to oversee implementing diversity, equity, and inclusion in clinical care. Shannon Slatton sat down with Dr. Asfia Qaadir to talk about this for today's Newsmakers.
It seems like DEI has really taken off across healthcare organizations, and at PrairieCare we're very excited to intentionally and very methodically implement DEI. For us right now, that means education and training for staff, and really taking the time to learn about historical roots of healthcare inequities and how that impacts patients, and understand implicit bias, understand racial trauma, and start to shift the way that we do care so we truly are caring for all of our patients.
And what inequities do people of color face when it comes to mental health care?
You know, I think for so many families, they're so familiar with this. And one of the things that I would highlight is systemically. Systemically in this country, everything is connected. So when we think about housing and we think about stable employment, opportunities for education, these are all linked. And healthcare access is linked to all of those pieces. And especially in context of COVID, we've seen how healthcare access can be lost for a lot of people if they lose their job.
How tough is it to access care?
Oh, it is tough. And I think it's a layered question actually, because even if systemically you have adequate insurance, you have the ability to get to a clinic or access the care physically, you know, once you walk through that door, what are the odds that the clinician is going to understand you or is going to appreciate the nuances of your experience?
Okay. And what are some of the challenges that you're facing as you're trying to overcome these barriers?
Well, it's a pretty cool challenge actually. I think a lot of the staff and a lot of the employees that we're working together are just ready for this work. You know, we are ready to step up and we are ready to implement DEI and get this good work started.
Okay. And what can we or community members at home do to help be a better ally?
I mean, I think families have done so much for so long, you know, and what I would say is keep telling your stories. You know, we here at PrairieCare are listening, we are ready, we want to help, we're here. Keep telling your stories, pick up the phone and seek care when you need it. We're here.
Are you excited to go down this path of work?
I am. It's such a cool opportunity. It's really, really exciting. It's very creative work. It's very compelling work. I think many of us within healthcare have known that this work needs to be done for so long. So to see this movement really take shape, it's a very exciting time.
All right. Well, we wish you the best of luck. Thanks for being here and talking about this today.
Well, thank you so much.
Find more local news stories at ccxmedia.org and follow us on social media.